There we go. Okay. There we go. Thank you. Okay. So here we are. And just for the record, for the video, we are in Senior Roundtable, the November meeting. Okay. So we will post this on YouTube once the meeting is over, sometime beginning of next week. We'll get that out there for you. So if you wanted to share it, or you missed a part, or you want to go back to listen to one of the speakers, you've got that available too as a recording. So who is Senior Roundtable? For any folks that are brand new to this, or it's been a while since you've been in a Senior Roundtable meeting, it's anybody who is interested in the elder sector. It's free to attend. We meet every other month. We are targeting January's meeting to be in person. You'll hear more about that and how that's going to look if we're able to pull that off. Everybody can attend. You can send it to anybody. They can get signed up with Gabby for the email distribution list themselves. And the program is always something that the group behind the scenes called the Senior Advisory Committee says, this is a good topic that people would benefit from. Let's go ahead and figure out who's the right speakers, who's the right organizations, etc. So very appreciative to everything that they do. And the number one reason why this was all started was networking, for people to know who's doing what, for you to connect to resources, etc. And then you can see our mission statement there at the bottom. So our agenda for today is right here. Let me get everybody out there. We will start pretty quickly here with the organizational announcements. Anything that you have that you would like other folks to know, you'll hear then from our sponsor. We have a couple of opportunities for networking, for you to meet some other folks here, or say hello if it's been a while since you've had a chance to say hello to somebody that you're used to working with more regularly. And our topic, fantastic and great speakers and organizations, you can see that there. And at the end of the meeting, for those who are with us, you have to be present to win. Sol and her organization has 2 beautiful gift baskets that will be delivered at some point to the 2 people that are chosen randomly for the door prizes. So our sponsor provides the door prizes. We're very grateful for that, and you'll hear more about that here shortly. So if you do have any announcements that you think would be great for this group to know about, an event coming up, something that you're looking for partners for, anything along those lines, as the whole meeting is taking place all the way up until 10:30, please feel free to put those in the chat box for folks. If you've got contact information or a website that they can go to for more information, let them know that also. You can see Sol's put something in there already with the phone number, her email address, etc. So anything that you think would be helpful. I know ElderSource has a huge event coming up for them. And so any of those kinds of things, put it in the chat box. People can see it and they can find you or ask more questions if they would like additional information. We also have, Linda just put that in there, Night with the Stars coming up in just a couple of weeks. We also have a LinkedIn page that if you want to join that, if you haven't already, that's another place that those same things that you're putting in the chat box can go. I think maybe a couple hundred folks in there. It's also a good way for if you meet somebody in one of these meetings and you're like, okay, I met that person, she was with ElderSource or whatever, you may be able to find them in that LinkedIn group to get back to that person that you meant to connect with and just didn't get the information you needed. So that's available to you anytime that you would like to. Feel free to post in that LinkedIn group as well, especially in between our meetings. It's a great way to keep in touch. So with that, I'm going to turn it over to Sol. Sol, you have 3 minutes on the clock for your organization. I know you're passing the baton to someone else that's going to help you with that. So Sol, you've got it. And I don't know if you need to share your screen. If you do, just feel free to bump me. You should be able to do that. And Sol, you've got it. 3 minutes on the clock.
Thank you so much. Good morning. I'm really humble. My name is Sol Winter, and I have been part of this meeting in the past. And today I am here representing Simply Healthcare Plans. I'm going to be very honest. There is no sharing of any type of video or any type of PowerPoint. I normally am just the normal person out there, but I wanted to say thank you, Laura, for considering us to be the virtual sponsor this month, as well as I'm going to share a little of what Simply Clear Health Alliance is. So Simply Healthcare is a Florida managed healthcare plan that currently serves nearly 860 individuals. So we are a Medicaid health plan. At the same time, within that component, we do have several lines of business, which will be long-term care in certain regions. We do have also the Florida Healthy Kids statewide and the Medicaid in certain regions of the state of Florida. Mainly, we have a specialty plan, which is the HIV AIDS specialty plan that we hold a contract throughout the state, and that is under Clear Health Alliance. And that's why I have a Clear Health Alliance as well as a Simply Healthcare plan. So you will see me in the community, you know, tabling, supporting the community. We're very proud of the work that we do. And, you know, just being part of this organization, working with you in the community, supporting the many causes that, you know, every one of us believe in. And, you know, we are grateful to have the opportunity to support this effort and be more involved. At the same time, I will share that with us. We have Melinda Blankenship, and she is our network contractor for the long-term care. I'm going to allow her to introduce herself, and that way we can turn over the floor back to you. And if you would love to learn more about Simply Healthcare Plans, please visit our website, simplyhealthcareplans.com. And at the same time, you know, I'm sure we will be seeing each other as the months, you know, progress and the new year comes in for our Medicaid outreach. Thank you so much. Melinda, please go ahead.
Thank you, Saul. Good morning. Can everybody hear me? Okay, perfect. I saw somebody's head shake. My name's Melinda. I am actually the Senior Network Contract Coordinator for Simply Long-Term Plans. We are currently working on the RFP for the state to expand into other areas, and my job is to go and get the contracts from the ALFs, the adult daycares, and the adult family care homes. So we're trying to be more present in different areas. We only have certain regions right now, and I'm in charge of trying to get Region B under our belts for the state of Florida.
Thank you so much, Melinda. Thank you again, Linda Levin, for being here. I see you, and I know we have not exactly seen each other, like, you know, in settings, but Laura, again, thank you. Renee, it's good to see you, and, you know, the new faces, but I look forward to, as well as Melinda, to be in the community and supporting your efforts moving into 2024. Thank you.
Excellent. Sol, thank you so much. And thank you for being willing to be a sponsor. And if anybody noticed, behind her are some beautiful baskets going to the 2 winners of our door prizes today. So looking forward to that. We'll do that at the end of the meeting. You will have the ability to come back and listen to any of these on the YouTube recording post probably beginning in next week. So that's an option for anybody who doesn't want to take notes, but they want the details of what they've just heard. So I'm going to stop sharing. Brittny, if you will do a self-introduction about yourself, organization, and then you've got the floor and you're welcome to share your screen if you would like to do that.
Okay, I will definitely share my screen. Let me make sure I'm sharing the right screen. Okay. I have like 3 monitors. Sorry, you guys.
I hear you.
I have to like keep the queue up at all times and everything else in between. So if you see me looking around, I just got computer screens in front of me. And I have a dog, so please excuse me if you bark or something. I apologize now. It's work from home day today. So my name is Brittny. I am the 211 operations supervisor here at United Way. We are a call center. We are 24/7 currently at the moment. We always been 24/7, but we have recently started back doing our own 24/7 hours. We used to outsource to another call center in Miami, but that had stopped, our contract stopped. So now we are 24/7. So if anybody needed to call 211, oh my God, you have 3 shifts going. That is my contact number, my office number, and my email. Best to reach me by email. Just right now, I'm on a loaner laptop and our phone networking system is just not connecting right now. I'm still trying to get my technology fixed, but that is my information if anybody needs it, though, sure. So what is 211? Basically, we are a helpline. We offer information and referrals to the community. Anybody can call in, and it's not, we aren't age or elderly or gender, anything specific, but it's open to the whole community to call in. We don't really advertise. You will see people throw 211, call 211, call 211 for additional resources. We are a helpline. We are not 411, we are not 911, but we are an information and referral line. We try to connect people to the resources and referrals that they need in their community. We serve 9 counties. Those include Baker. My screen is, I'm gonna put you guys down, I'm sorry. Baker, Clay, Columbia, Duval, Hamilton, Nassau, Putnam, St. John's, and Suwannee. Clearly, some of the smaller counties will have a little less resources than some like Duval. But what we do give out, and that's the main thing, let me say, only referrals or information that we give out are ones that are vetted and put into our database. So I know we're here talking about resources and data. So our database includes organizations and resources like food pantry shelters, mental health clinics, anything kind of get economic stability going on with financial or legal services, childcare services, and crisis assistance. Part of that includes our Mission United and our Crisis 988, which are separate from 211 these days. We used to, at one point, take crisis calls. Our agents used to take information and referral calls, but as you all know, back in July, the National Suicide Line switched over to 988. So that we once were a blended center, we are now what we call a separate center. So we have information and referrals, and then we have a crisis line. We are in the same building. We are both a part of United Way, but we're just different call agents. The ways to reach 211, you can dial 211, you can text hello to 211-904, or you can find us via email. If you get an email, or some people go through email, like I guess some may have situation where they cannot talk or speak and they send an email out, those get filtered through me, but we reach back out. But we do have to do an intake on our callers, so we do ask that we kind of direct them back to the main line. So that's where we say just dial 211, or they can do it via text. Our main lines of what you hear like on the IVR are for information and referral, our veteran line, our first responders, and what we call trends. And those are typically based on the season. Coming up, our trends will be either holiday. We got some holiday gift baskets or holiday information that people give resources to that they'll call in for to see who's giving out gifts and toys for the holidays, or food baskets for Thanksgiving. And then, of course, in the upcoming year, at the beginning of the year, we'll start doing tax calls and partner with Real Sense. Our first responders, if you're unaware, that's the government program for first responders active duty. That is a big initiative they're trying to push right now for mental health or and resources for our active duty personnel. These are just some of our stats from our last fiscal year. As you can see, we get a lot of calls that come in. I have 12 agents right now at the time. So it can be overwhelming on certain days. Our queue definitely reaches on a busy day. Our volume gets up. I'll say at the end of the day, we'll have maybe 400 something calls that are queued, and we may not be able to handle them all, but roughly we're handling about 300, 280, 290. Our top needs in Duval County, what we see coming in right now, clearly is rental assistance. We are still in kind of what we call a rental crisis with evictions and just late payments. Our top, it kind of flips between rent and utility. So utility payment assistance is a big thing too as well that they're calling for. And then food pantries, of course, with inflation, the price of groceries. Those are some of our top three that we get those calls every day, looking for assistance. The numbers next to are the referrals that we've given out for them. Then we have rental deposits, which of course correlates because of evictions and things going on. Then now people are looking to move and they need help paying that deposit because they can't pay the deposit and the first month's rent. And then of course our Real Sense tax credit. These are some of the referrals, our top 10 referrals we give out. If you see your name on there, thank you for being in our data system. But a lot of times what we do with our intake, we go by our zip code. So we are either if they're a first time caller, we're doing and asking the questions. If they call them for it, then of course we're verifying, making sure that they're still in the same zip code. We'll put in the zip code and then give them agencies in their area that are close by or things that are assisted them that they qualified for. And you can see some of our top agencies in our system that we give out quite frequently. So how did this work? Basically, like I said, like once an caller calls in, we just ask and verify their phone, their name, number, zip code. We do an intake or series of questions of roughly around 16 to 18 questions. Some are more demographic and some are grant purpose questions that we ask. They do have the right to refuse any questions that they don't want to answer, but the more they give, the more information we get, the better resource we have to give them. We do explain all this on the calls. Roughly our average channel time on a call is about 7 minutes. So we do ask them when they're calling, they have a little bit of time to kind of go through the questionnaire. Some people are calling at work and they're trying to do it in between breaks or while they're at work. But nonetheless, you call us whenever you can. Like I said, we are 24/7. So they call in and go through the assessments, and then we get good cases. We like to get what we call good case notes on them, create a file, a client profile for them in our database, and it keeps them active for a while. So we won't have to re-input the information if they have to call back in. We do, and I know this says if they meet criteria for direct referrals. So I know some of you may or may not be aware of direct referrals. We are partnered with 3 agencies that we do direct referrals with. A lot of the times, and I would say like 75% of the time, people calling in, they are calling in for a direct referral. And I will explain that process just a little bit because it is a big part of some of the resources that we give. We are partnered with Catholic Charities, Desk, Downtown Ecumenical Services Council, and this is my last one, Jewish Family, that give direct referrals for some of their callers. So when those callers call into those agencies, they will be directed back to 211. We do not approve or deny anyone. Let me say that we are just pre-screening for these 3 agencies before we send them over to them to get to finish their applications with them. And that's kind of maybe a misconception that some people get. We do kind of the beginning work, and then they come back in our system, in our database, and look at it, and they'll finish the outreach and the process of the application. 211 does not, we are information referral line, but we are not case or care management. We don't do follow-ups or go throughout the length of the application process with the caller. We want to give them the numbers and the resources and have them finish the work to more so empower themselves and to get more assistance for themselves. But we will try to give them at least 3 referrals or referrals or resources that they can call on and look into for assistance. We may offer follow-up if we need to. We give them something and we're not sure if it's more of a complex case, and then we may need to call them back to make sure everything went through. If there are veterans, we have veteran care coordinators. They will do more case management, and if there's more of a complex case, we'll have them reach out to them and assist them and kind of talk more through them and maybe give them more additional resources that we may not have, that they may be aware of because they just are veterans. And then if it's more of a crisis or mental health, we do refer them to our crisis agents. That's the database. I will just wrap that up. If you are interested in being in our database, these are our database worker and outreach worker and my database manager. We are more than welcome to add more people to our database. It is a form online, and I will definitely leave this information and give this to you all if anybody wants to be added to our database to be included as a referral or resource in our database.
All right, Brittny, anything else? We got probably about a minute left.
Not really. I know you wanted me to touch on disaster, but we don't we are still open during hurricanes. I will say that we stay open as long as the agents can work, and it's not like life-threatening. But most of our stuff or assistance will come in after the days of a natural disaster, and people are calling in around to see what resources and things are out there for assistance and for cleanup and things like that. We do refer them if it's emergency to better call 911 like during that time. It is slow during the natural disasters, but afterwards, what we do is partner with other agencies. They will give us specific resources and things to help with the hurricane cleanups or anything like that, and then we just give those out as they come in. It changes rapidly; they change daily, and we just kind of give those out in times of disaster needs. Okay.
Brittny, thank you so much. And if you have any information that you would like us to include when we send the post-meeting email out next week, like if you have a brochure, flyers, any of this kind of information, please feel free to give that to us. We'll also send it out. And if you have anything that you want to put in the chat box still today, you can put flyers, attachments, you can put your contact information, any of those things that you would like to do also.
I'll drop my contact information. We don't really give out flyers. We used to have like little business cards. I do have an outreach coordinator too, and she kind of goes out and picks things up. But I will definitely give you guys my drop the contact information in the box for you all.
Brittny, thank you so much. Very appreciated. And again, you know, if you need additional information, please contact Brittny. Lots of different things that 211 helps with. Absolutely reach out to them. What a great resource. We're moving on to Eustachius, and I hope I said it correctly. Eustachius, you are up. And feel free again to share your slides if you would like to. And I saw that Eustachius had logged in, so hopefully I'm not catching him off guard.
Not at all. I'm ready for you.
All right, and do you want to share your screen?
No, I will not, but I did drop a couple of links in the chat.
Right.
So thank you for the introduction, Laura, and you did pronounce my name right, so you get a gold star for the day. Thank you. So I just dropped 3 links. The first one, first of all, just to back up, my name is Eustachius Roberts. I'm the Community Outreach Manager for the Senior Services Division for the City of Jacksonville. And we have tons of services and resources under our belt. We have our senior centers that are available Monday through Friday, 8 a.m. to 5 p.m., free breakfast, free lunch, free activities all throughout the city. We have 15 that are currently active. We have various services such as the Independent Living Program, which provides respite and relief for caregivers, and also volunteer opportunities for seniors through that program. Senior Companion, foster grandparent if you want to mentor an elementary school age student, and other opportunities to interact with seniors that are their peers, but also people of all generations and populations here in Jacksonville. So I just said a mouthful. I know it went in one ear and out the other. So if you could click that first link, I'm going to talk to you a little bit today about our annual Senior Services Directory, and we put that out in partnership with Heritage Publishing. It comes out once a year, comes out in May. We're running a little bit low on physical copies right now, but we'll be re-upping at the upcoming Senior Expo on November 28th and 29th. So if you have any clients, seniors, friends, colleagues that will be in attendance at that event, they'll be able to receive a free copy. But what a lot of people don't know is that we also have this online. You can scroll through it. It's mobile friendly. So I recommend, you click on that link, the first one for Heritage Publishing, flip through it while I'm speaking and see, what jumps out at you in the guide. And then there's also an opportunity to download it in the second link directly from our website at jackseniors.net. So if you click the second link and you scroll towards the bottom of the page, you can download this resource for sharing. So with that being said, I'm going to jump into a little bit about the guide itself. So like I mentioned before, we have a ton of resources here with the City of Jacksonville, and this guide is a great resource to become acquainted with that. There are also opportunities for other organizations to feature their resources and activities and events, and through advertising or through various sections of the guide. But close towards the beginning, you'll see the table of contents, and it'll go through a couple of documents from the city, such as the letter from the mayor, letter from our chief of senior services, Gloria Crawford, and our senior events program manager, Stacy Amperin. But once you get past that, you're gonna hit the list of city resources, and it's going to be page after page after page after page of information, and I guarantee you're going to learn something in there. It's going to start off with our list of senior centers throughout the city, the contact information, all the addresses. It'll have a map of it. It has you can find your city council members in there, in their district, their contact information. It's going to have some information about JHA, the Jacksonville Housing Authority, the Neighborhoods Department, and various programs under them. And then also senior events. And that's just the first couple of pages. It's going to talk about senior services or social services through the city, and numerous, countless resources that we don't have time to go through on the call for everyone. But I strongly recommend you take a look at that guide and just kind of flip through it and see what's relevant to you, relevant to your colleagues and your clients, and to share and disperse that information. And like I mentioned, that's going to be re-upped on November 28th and 29th. So after that date, you all are welcome to swing by to our office, come pick it up there. You can pick it up at a senior center, at the libraries around town if you can't make that particular event. So you can also email me directly. That last bit in the message that I sent is my email address, eroberts@coj.net. Just to let you know, I will have to jump off the call a little bit early after my portion. Laura, we are doing our Walk for Senior Wellness over here at the Legend Center, so I'm jumping around a little bit today. But in the guide, just to continue on that, you're going to learn about the parks and recreation. You're going to have a list of all of our parks, community centers. If you didn't know, we have over 400 parks here in Jacksonville, the largest park system in America. So you're going to find anything regarding from resources for healthcare, for socialization, well-being, whatever you need, it's in there. I mean, I'm flipping through the pages right now. We have our list of our aquatics offices, our community centers, the disabled services. You'll see some in-depth information about our various programs that I mentioned before for independent living, to provide respite for those caregivers. The senior companion program, list of libraries, and so on and so forth. And that's just the city of Jacksonville information. That's just the city of Jacksonville information in that first section. So if you go past that and you flip through the table of contents where on screen, they're going to have library locations. They're going to have the tax collector offices. They're going to have a list of assisted living facilities. They have retirement and life care communities and homes. They have skilled nursing facilities, designation of healthcare surrogate on page 105. They're even discussing living will declaration at 106, special medical needs registration forms, applications for disabled person parking permit, and also a list of advertisers if you're interested in having your organization featured in this booklet. But it is an incredible resource that comes out every single May, and it's available online. It's available for download, and after we get those new directories coming in November, later this month, they'll be available again at the libraries, all of our local senior centers, and of course City Hall. So with that being said, that's just a little bit of what's going on in the book. I'm not going to go on and on and on and on and on about every little thing, but I did want to leave a moment to see if anyone had any questions about the directory or senior services in general related to it.
Any questions before we let him go on to his very, very busy day?
I just have a question. This is Dawn with the Division of Line Services. I cover the Jacksonville area, but I also cover 8 counties around the Gainesville area. Do you know if there's anything like this for the Gainesville area in outlying counties?
I'm not sure, but there may be, for Alachua County. So I will look into that. I'll look into that and I'll follow up with you. And I recommend shoot me an email and about that at eroberts@coj.net, and I'll look into that for you.
I appreciate it. Thank you.
No problem at all.
Anything else for Eustachius before we let him off the hook here? Okay.
All right. Okay. Well, I'll give you back a little bit of your time, Laura. I appreciate the opportunity again. Thank you all. Hope you have a great day and a wonderful weekend. And I look forward to continuing our conversations and servicing the senior community together.
Oh, you're awesome. Eustachius, thank you so much. Have a good rest of your day. Good luck.
All right. You too. Thank you.
All right, we are moving on to Trish. And Trish, you've got the floor. Feel free to share your screen. And if you will do, again, a self-introduction and your agency, and if you'll set a timer for those 10 minutes, it is appreciated.
Okay, let's see if that's going to. Okay. Can you see my screen?
Yes.
Okay. All right, it's up there. My name is Patricia Vidal, and I go by Trish, and I work for the Agency for Healthcare Administration. Our agency license facilities throughout, I think, over 50,000 facilities throughout the state of Florida, which consist of hospitals, nursing homes, ambulatory surgical centers, assisted living. We are in our area, this is the data dissemination unit. So we collect a lot of data. We collect all the discharge data from the hospitals, EDs, and ambulatory surgical centers. And we are tasked statutorily to publish that data. And that is the main driving force for building our transparency websites. And we have a couple of them. The statutory request was to publish the data in a useful manner that would benefit the consumers. So the website that we have is it's going on 20 years old, I believe, and it's been through a couple different changes. The one we have currently is, I think, relatively easy to use, but again, I'm in it all day long. So we do hold webinars that do training on walking people. So for different groups that say, hey, we have a need and we would like someone to walk us through, much like we're going to do today, but I won't get as in detailed because of the time constraint. So this is the primary transparency website, and the biggest need, I guess, for all of you is where are the resources within this website and what else does it link out to? So on originally it was built with the locate option as the primary use because people needed to know how to find the facilities and how to maybe sort them if they were just looking like for assisted livings or if they were looking for hospitals in their area. So this is the home page. You can see the two primary buttons at the top in the static header, which are compare, which would take you to the measures that are populated based on the data we collect. There's a price button, which links you out to a whole nother website, which is the Florida Health Price Finder, and that gives you average cost of procedures like in a care bundle. So maybe if you were getting a knee done or a hip, you could see what that average price was in your area. And then locate, which is the other tool within Florida Health Finder. And then we have a call to action button, which again, it goes to the primary tool in Florida Health Finder, which is is the locator where you would search for facilities. And then at the bottom in the current system, these panels open up and they give you links to the resources that we have available. So the healthcare resources is probably used the most because it tells you, or it links to things that are within the agency, like the Gold Seal nursing home dashboard. And a lot of people do go out there and look at that if they're looking to place someone in a nursing home. Inspection reports can be found here. Just a general information about Medicaid. ACA does manage the Medicaid population, and that's difficult to get information about. So we did put a general information page out here that helps individuals get to the right numbers to make the connections that they need. We have a prescription drug pricing website, which is a site that we also updated recently. And I'll give you the preview of that right before I get done here. And then we have healthcare education. So there is, these are a couple tools that are within the Florida Health Finder that helps people understand if they are looking up a specific, ear infection and need to know more about it, or if they're planning to go to the doctor and they have some symptoms and they may are maybe they're trying to decide if the symptoms are bad enough and they need to go to the doctor, or they want to take a little checklist with them on things to ask the doctor. We also disseminate data. So the statutory requirement is that we would collect this data and publish it. And we also have to collect it and put it in a format that when we publish it, it's useful to the consumer. So, but we also do other dissemination activities in that we provide data to different like groups through Florida that use it for trending, for deciding if they need another hospital or nursing home in their area, just, you know, to trend to see if there's enough doctors to cover the people of that city or that county. We have universities that pull the data and trend for things like, I think we've done some for mental health, for childbirth. We've had several requests for COVID information. So although our information is limited to just discharge data, which is hospital, ambulatory surgical centers, and EDs. But we do collect that, we process it, we package it, and then we give it to this website to disseminate it. Or we package it and send it to the person who's requesting it, be it we do get federal government will request it, our state government requests it, universities request it, individual students that are going to the universities may choose to purchase it. And so it's a good source for aggregate numbers that tell people what the individual case that they may be looking at, how it weighs out through the state, because it can be divided by county. And then other health information. So we do have some other links that go out to other programs that are within our area. And then ACA resources is how to contact ACA. And I think that's kind of got most of the information. We have a privacy statement and a disclaimer. Those are probably necessary. So for compare is the data I was just talking about, those measures that we then, after we collect, that we feed back to this particular website. And it is only for specific facility types. So we license these and we collect data from them either because it's statutorily required or because we have that data collected and available to us by that unit. So things like hospice and hospital, but I'm going to click on hospital real quick because that's something we can all understand. And so on the hospital, we do have 2 other radio buttons that you can click off. The summary gives you all of the information that you see here. And I can make that a little bit small. And then the HCAPS is, because it's so many lines, it's on a toggle button by itself, and it gives you the ratings for the hospitals. And these are, the way it's set up for me is that I'm in Tallahassee, so it pairs it down to just show me the Tallahassee group there. And then locate will give you, and I'm going to go through faster because I think I've got just a minute or so. Locate allows you to do the same thing, to find a facility. Quickly. And you can click on a facility and get what we call the profile page. This offers a map on how to get there and a lot of ownership information, number of beds, if they have special services, and all of that's provided during the licensure process. And we track that and provide it back to the consumer. So that's in a nutshell what we have there. The second, sitting right on top of, this is the one I need. Okay, so I did say that I was going to give you a preview. We are updating the website, and this is the new look and feel. So it's a little more modern. We have the same information that you saw on the panels will be available in these different tabs at the top. And I think they're organized better here so people can understand what's in each tab. But we have agency information, healthcare information, external, okay, and external resources, and then other links. But the compare button is there. It is also here. That's a call to action button, and you can do the same thing. You can either search those specific facilities or go out and locate a facility. And then you have some other things. I did share the link, and I guess the best way to do with this is that once it's out is to just go there and just go through it a little bit and see if there's information that you need. And we're available. You can always contact me directly or someone in my team, and we'll be happy to walk you through it or answer any questions. And I think my time's up. Sorry for going over.
No, awesome and great information. And thank you for the sneak preview. I think, is it like 3 or 4 weeks, the new website will be launched, is what you were saying?
Yes, we're hoping to do it like right after Thanksgiving, so it doesn't overwhelm anybody. We'll have a little bit of a window from beyond Thanksgiving till Christmas.
Excellent. And I think I saw you put information for contact in the chat box. So if anybody would like to follow up with Trish, please feel free to do so. Great information, and what a wealth for all. Yep. Great website. Really good information. So thank you for sharing that. All right, we are moving on to ElderSource. We have a couple of folks speaking from ElderSource, and Renee, I think you're up first. And if you're able to share your screens, and if not, let me know. I'll sneak your screens on the slides here.
Hi, everyone. I'm Renee Knight. I'm Vice President of Community Services with ElderSource. And ElderSource is the Northeast Florida Area Agency on Aging. And I have a great department. We are called the Aging and Disability Resource Center. And if you'll go to slide 2, Laura, we will talk about what area agencies on aging are. And in Florida, there are 11 of us. And I'm sharing this because we share in the same database and the same call documentation and resources, so we can see each other, we can make referrals, and have the information there together. So our area of coverage is slide 3, is the planning and service area 4. These are our counties where we have direct knowledge and direct referral sources, and know many of the providers. We have them in our database. So you will see this is our planning and service area. And the next slide. So our role as the Aging and Disability Resource Center is to integrate information and referral for all available services for elders with the eligibility determination and entities. So we're providing information and referrals internally and externally. The next is to provide for easier access to long-term care services by creating a multi-access point that flow through one established entity with wide community recognition. We are the only way that individuals can be placed on the wait list for long-term care, the Medicaid long-term care programs. We have an entire team that does the assessments and the placing people on the wait list. And then we have an eligibility team there to accelerate eligibility determination for their programs and services. And that eligibility team helps people when their names are released for services, help them through the Medicaid long-term care process for home and community-based, not for a nursing home. And the last is to manage the wait list for all those in-home services. So our screening team that has 13, soon to be 14, that are doing those assessments are placing people on the wait list. So next slide, please. Okay, the helpline. The helpline is a gateway to many of the community resources for both aging population caregivers and persons with disability. Our goal is to connect the customers with the information and resources they need. Our partners, 211, we use ACA's website that you saw for the most current licensure information. But it starts there because when in our assessment and in that call, you're finding out that they may need more than one thing. They may need those direct referrals that 211 has. So we would send them over to 211 for those. So it always starts with our helpline. So next slide. So how does this work? We have a team, speak with a customer service specialist to understand their needs. We're going to assess and hear what they're saying and maybe what they're not saying, so that we're giving them information that's current to them. We're checking their eligibility for existing programs and services. We are connects the client to the available resources. And we have the click and chat feature. It's part of our website at myeldersource.org, and they can click and chat with a helpline specialist. Fax is a huge way that our community partners are sending information to us, and I have that fax information on the last slide. So those are for referrals for screenings, for placing on the wait list, for general revenue program services like Meals on Wheels and respite and services like that. So they send us in those referrals, and then we're able to reach out to the individuals, to those clients, get more information, and set them up for a screening for to be placed on the wait list. And there is, unfortunately, there are wait lists for all of those services when it comes to, I shouldn't say all, because there's some home delivered meals programs that may not be waitlisted. But the next slide. So flows like this, calls into our helpline, customer service, 8 to 5. If it's after hours, it goes to a voicemail, and we will respond. Within 1 day is our goal. Sometimes with holidays and things, it may be a couple days, but we're working for the 1 day. If it is a call to our, and here everyone knows open enrollment for Medicare, we have our SHINE program, Serving Health Insurance Needs of Elders. Our referrals go over internally, direct over to our SHINE department, who has our team of 40 volunteers who are busy right now doing that counseling and doing presentation and educating individuals. These are non-biased volunteers who are so knowledgeable and empowering people to make decisions about their Medicare. The next is our statewide Medicaid managed care that I spoke about, and that is people calling in to be placed on the wait list, and our team, and we refer quite a few over to CARES and to Department of Children and Families. They're our partners. To the CARES team, if there's someone looking for nursing homes. So we will connect them to CARES. And if they have questions with their financial eligibility, we're going to provide information how to do that through Department of Children and Families. The last is to connect them to resources. And internally, we have a wealth of programs for caregivers. And I think Andrea is going to go into more of those details. So I'll leave it at that. But the external is we refer often to ACA because people are looking for facilities, and that is we will go in, print the list for them, email it to them if they're looking for assisted livings in their county. So it's a really good resource, and we're able to get it right down to the people who need it. And then we're also to City of Jacksonville and other energy assistance program providers, or any of our other partners. We're giving out referrals. And I'm going to, I think it was Brittny who was saying, we are finding the very same things that our top needs are actually about 85 to 90% of our calls are coming in are direct referrals asking to be placed on the wait list for programs, in-home programs. But housing rent is a big need. Utilities, we're seeing those types of calls. We've seen the increase with the rent and homeless of our seniors. So experiencing the same things there. So our next slide. These are some of our stats, just so you know. We have 8 customer service specialists, number of calls in 2022, and you'll see that there in our inbound and our outbound. In our voicemails, those are after hours calls, or when our specialists are on the calls and they're coming in faster, especially that middle of the day. They can leave a voicemail and they'll get that call back. Internal referrals for screenings, we have 775 to 1,000 a month. And referrals to Shine over there for that. Counselors for Medicare counseling, 230. It will go higher during this October through December time frame with individuals wanting to have that counseling. So that's it for me. If there's the next slide, let's see. I think I do have the call center. This is our fax number. I will include the intake referral form if someone needs it, Laura. When in this presentation, you're free to send this out. So they will have that intake form. And there's my contact information, and also our supervisor for the helpline is right there.
Renee, this is Linda. Great presentation. Is there, for folks who might want to be listed in the resource database to receive referrals, how do they do that?
Sure, they can do that through contacting Devette Wellmaker. And she can get that information to them. Thank you, Linda.
Yeah, and I think there's also inclusion-exclusion criteria that
absolutely
mandates. I know I saw 211 also mention that in their presentation. So
yes, yes, yes. Thank you,
Renee.
And Renee, thank you. Excellent job. And I will include your slides. Thank you for giving us permission to do that when we send out the post email next week with the link to the recording, etc. So very much appreciated. Great information. All right, Andrea, I think I have your slides up. Tell me if I'm off.
You do, but it looks like, can you go to the next slide? Because it lists all the different programs. There we go. Okay, I'm going to put my timer on. I'm going to talk very quickly so we give Elizabeth Paulson, who's our last speaker of the morning. I'm Andrea Spencer, and I'm Vice President of Communications here at ElderSource. And I'm going to talk about a group of programs that focus on our caregiver support. And about 3 years ago, maybe a little bit more, we realized that caregivers are such a huge part of our mission. Even, you know, we are targeted to individuals 60 and over and persons with disability 18 and over, but it's all those caregivers that come into that helpline that are calling on behalf of their loved ones. So recognizing that over the last couple of years, we've really amped up a number of our caregiver support programs. The very first one I'll talk about is next slide, telephone reassurance. And that's a friendly call to an older adult who's living alone and they're homebound. We have background checked and trained volunteers to make those friendly calls. So it's kind of a two-way street with telephone reassurance, in that you can be a volunteer to make those friendly calls, or you can recommend that someone receive those friendly calls. And usually it's on a weekly basis, and sometimes even more. Next slide. Our virtual caregiver support group actually started a little bit before the pandemic, and now we have 2 support group times that are available. One's like in an afternoon and one's like early evening. And this is a place for caregivers to kind of literally gather around their screen and talk with other caregivers who are walking the same walk. It's face-to-face, it's real time, and they're sharing their stories. They laugh, they cry, they are just bonding together during this 60 to 90 minute session. And the team of people, the individual who's leading the group, she serves as a facilitator for these individuals. And, you know, sometimes they come every week and sometimes they don't, but it's really just a wonderful time to really talk with people who you know can relate to exactly what you're going through as a caregiver. Next slide. We had mentioned earlier our T-Care program, Tailored Caregiver Assessment and Referral. And I think if you're out in the field and you're talking to caregivers, they're exhausted. They feel like they're the only ones that are walking this walk. And this particular program gives them the tools to reduce the stress, creating a care plan for them and connecting them to the resources that they need as a caregiver to be the best caregiver that they can be. But that burnout is so real, and it's so tough to find ways to really take care of yourself. So that particular program is super important. Next. Powerful Tools for Caregivers is a 6-week class. It's held once a week, and they're led by experienced class leaders. And it gives the caregivers the tools that they need to be the best caregiver they can be. It helps them reduce that stress, changing that negative self-talk, how to communicate with sometimes those difficult conversations with family members, and then dealing with those difficult feelings. And it's so much more than that. T-Care and Powerful Tools, and these programs are not funded by state and federal dollars. And we've received very generous grants through Humana and Florida Blue that they have just been so generous that we're able to do these programs, as I said, that are not necessarily funded by state and federal dollars. Next slide. And lastly, I want to talk about the Caregiver Coalition. And I see online today that we have a number of people who are members of the Caregiver Coalition. We have scooped this up. It was formerly under the umbrella of community hospice a number of years ago. And again, as I mentioned, we realized through our strategic planning that caregivers are such an important part of the work that we all do. So the coalition is a group of a variety of senior agencies, and we offer virtual events, in-person events. There's a quarterly newsletter and information through the social media. And it's really, if you go to caregivercoalition.org, you'll see the list of the recorded virtual events that we've had. And we are in the throes of planning for 2024. So if you want more information, next slide, please. Caregiver support at myeldersource.org. All those programs that I mentioned, you can get to Abigail Costley and her team. And then anything about the Caregiver Coalition, you can give me a jingle, and I'm happy to connect you to any of the information about being a member. So thanks so much. I talk really fast, but it's all good stuff. A lot of good information. So I hope you're probably a bit on overload, but it's all really good stuff. So I'm glad to be here. Thanks.
And that was awesome. And again, the goal of this is to give folks knowledge that these things are out there, and then to dive deep into those that are going to make a difference for their lives and for the seniors that they're working with. So thank you for that. Elizabeth, if you'll leave me 2 minutes, can you do a quick overview of the couple of programs that you wanted to talk about and share with others? Elizabeth, you're muted. Still muted. Still muted. That's just sad. Waited this whole time for her turn. So you can check down by the audio by your mute button. There's a drop-down box that might help you. Okay, so Elizabeth had several different things that she is going to share that JEA is involved with or promotes or helps with. She sent me 3 flyers. We will include those, great information about those. And Elizabeth, can you put in the chat box what those 3 things are? And I'm going to switch over to my slides and get us over to the door prizes, etc.
I'm so sorry. I just found you. Thank you so much. I am just going to quickly just show people at JEA.com. My laptop's all messed up right now. So this is a community resource page on JEA.com that I'm trying to share. Let me know if you cannot see it.
Got
At
it.
the bottom of the page here, we have a list of exactly like the Quality Health Finder. We have different places where you can get resources, and many of these have already been discussed, but I wanted to bring it to your attention that the city of Jacksonville does offer assistance with utilities in many different ways. Every phone number is listed on here, along with housing services that some seniors may be eligible for, just like Renee and mentioned. There are wait lists for many different things, but to get onto that is important. Feeding Northeast Florida also provides food pantries all across. You can put money back in a senior's pocket. And we also have a partnership with Lutheran Social Service. And if you know a senior that's looking for a part-time job, they've got lots of coaches to help seniors with budgeting. So I just wanted to bring this page to your attention. Once again, it's JEA.com, and you're looking for community resources. Please let me know if you have any questions about that. I think I just spoke for 2 minutes, and I would love to answer any questions that people might have.
Awesome. And Elizabeth, we will include your attachments that you sent when we send out the meeting notes next week, along with, I'll pull stuff out of the chat too. So if you see some things in chat and you weren't quick enough to grab it, we set it up that you can grab chat also. But if you can't grab the chat, we also have it that we will clean that up and send that out with the post meeting, along with the handouts from multiple of the speakers. So could I please thank everybody that's on this list? They do the work behind the scenes to decide on the program, reach out to the different organizations and speakers, etc. If you are here, if you will please give us a wave here. That's our group. Awesome, and cannot thank them enough. And our last piece here, huge thank you again to Soul and Simply, I may say it correctly, to Simply Clear Health Plans, or Simply Health Plans, Healthcare Plans, I think is the official title there. And we are going to move now to the door prizes. So we've got 2 gift baskets that'll be delivered. And Isis, if you'll share your screen, we are ready for you. And let's see who is going to be the lucky winners.
All right, can you see my screen?
I can, yes. If you want to do full screen and
yeah,
your spin.
Okay.
Dun, dun, dun. Rosa, are you here with us? Do we see Rosa? Rosa's still on the call. Rosa, if you're here, let us know. I'm gonna look at the participant list. I don't see Rosa on here, so we may need to skip that one and go to the next one.
Spin again.
I think Nicole is here. Nicole, give us a wave, something. Nicole, are you here?
I am here.
Hey, Nicole, all right. I'll get in touch with you after the meeting. And Isis, if you'll give us one more.
Got it.
Gabby, our hard worker behind the scenes. So Gabby, there you go. You get a beautiful gift baskets. All right. So we are out of here. Isis, thank you for everything. We will put you an email out there at some point to announce the 2024 dates. Speakers, you're fantastic. Organizations, you're fantastic. Thank you, everybody who came today. You are a new contact for somebody, and that's what it's all about. So thank you for being willing to join us today. Have a good rest of the year. Happy holidays, everybody, and we'll see you in 2024. Thanks, Isis.
Thank you, guys.
For inviting us.
Thank you.
Thank you.
Thank you, everyone. Happy New Year. Congratulations to the winner.
Thank you.